axillary, which then gives rise to the brachial, radial, and ulnar. And they have little asterisks next to vessels that create a pulse, palpable pulse. The last vessel here, ulnar arteries, I ran out of space, but there should be a little asterisk there because the ulnar artery, which is on the little finger side of the wrist, that carries a pulse with it. Okay. So, as we discuss the blood vessels, I'm going to use the cardiovascular part 1 PowerPoint, but I'm going to do a lot of drawing as well. Okay. I think when we dissected the heart, everyone found the right and left coronary arteries. That's the opening that's visible from inside the ascending aorta. Okay. Depicting the origin of the right coronary artery and the left main coronary artery. Right coronary artery, left main coronary artery. Okay. Those are the only branches of the ascending portion of the aorta. The right coronary artery and the left main coronary artery. Remember that the left main travels a centimeter or 2 and then bifurcates. The LAD, left anterior descending coronary artery, extends down to the cardiac apex. Okay. The LAD is running superficial to the intraventricular septum. And as it extends down toward the apex, it gives off little septal branches like this. So it feeds not only the left ventricle, and it gives branches to the free wall of the left ventricle as well, but also feeds blood to the septum. Remember that the second part of the bifurcation from the left main is this vessel here, called the left circumflex. This is going to travel along the left coronary sulcus all the way to the back of the heart. So it's going to feed the lateral wall and part of the posterior wall of the left ventricle. The right coronary artery travels within the right coronary sulcus, provides blood flow to the right side of the heart, and then extends around to the posterior aspect, as I've demonstrated here. In most cases, the right coronary artery gives rise to the SA nodal branch. The SA node is the heart pacemaker, so this is an SA nodal branch. And in most cases, about 60% of cases, it gives rise to the AV nodal branch. So it provides blood flow to the AV node as well, but the ratio is a little bit different. It supplies the SA node in about 90% of cases. It supplies the AV node in about 60% of cases. And that's important clinically. If somebody has a myocardial infarction due to occlusion of the right coronary artery, it can affect the cardiac rhythm. Okay. Now, within the thorax, the aorta has several different components. This part that ascends is called the ascending aorta. But then here to here, we have what's called the aortic arch. Okay. Look how the aorta coils back on itself. And then as it descends within the thorax, behind the heart, it's called the descending thoracic aorta. Descending. You can't just call it the thoracic aorta because all parts of the aorta are in the thorax. we say descending thoracic aorta. So again, ascending aortic arch, descending thoracic aorta. Now, when it passes through the diaphragm, what do you think it's going to be called within the abdomen?
Abdominal.
The abdominal aorta, yeah. So its name changes depending upon location. All right, we're going to dissect the dog later this month. We'll wait for the dogs to come in. But what you'll notice is the dogs have two branches that come off the aortic arch. We're a little different. We're a little special. We have three. Okay. And how many people here are college football fans? So this will make it a little bit easy. This will make sense to you. Other people will have to come up with their own mnemonic. And the mnemonic I use is BCS. BCS is old terminology to describe the college football championship series, okay, where teams were voted the national champion. There was no playoff series at that time, so that was the BCS system. And so if you're familiar with college football, I always thought BCS because it was easy for me to remember. But you can come up with your own mnemonic. Okay? B stands for the brachiocephalic artery. That's the first branch. Brachiocephalic. And, you know, this just tells us, the name just tells us that this vessel supplies blood to the arm and the head. So it's the arm head artery, at least to the right side. Brachiocephalic artery. The C, for the second branch of the aortic arch, is for the left common carotid artery. And then the S stands for the left subclavian artery. So brachiocephalic artery, there's only one brachiocephalic, there's not a right and left. So if there's only one, we don't give it a left or right description. So brachiocephalic artery, left common carotid artery, and left subclavian artery. Okay. Notice that the left common carotid and the left subclavian artery come directly off the aortic arch. Whereas on the right side, the corresponding right common carotid artery and the corresponding right subclavian artery, they come off a trunk, the brachiocephalic trunk, or you can call it the brachiocephalic artery. Okay? So whereas on the left, those vessels come directly off the aortic arch, on the right side, these come off of a brachiocephalic trunk. You can call it the brachiocephalic trunk or you can call it the brachiocephalic artery, either one is acceptable. Okay. But as a result, you have both the right and left common carotid artery. Their origin is just slightly different. Anytime within the body that you see the adjective common, something is common, it means it's going to bifurcate. Okay? And that's certainly true for the common carotid arteries. As they pass up alongside the larynx, okay? In fact, along the superior aspect of the larynx, you can feel your Adam's apple here. Along the superior portion is exactly where the common carotid artery bifurcates. When it bifurcates, it gives rise to an external, so this would be the left external carotid artery. And then it gives rise to an internal on either side, so this would be the left internal carotid artery. Notice that at the base of the internal carotid artery, there's a little swelling or bulb. That's called the carotid bulb, or some folks call it the carotid sinus. So what's the difference between the internal and the external? Well, the internal carotid artery is the one that's going to pass through the carotid canal at the base of the skull to provide blood flow to the brain. So that's what the internal carotid does. It provides blood flow to the brain. Whereas the external stays outside of the skull. It provides blood flow to the head, the neck, the face, and the scalp on that side. But it doesn't go inside the skull. It doesn't enter into the intracranial cavity. So again, the external carotid feeds the neck, face, scalp, the entire head and neck on that side, but not the brain. The internal carotid artery feeds the brain. In fact, there are 4 vessels that feed the brain. 2 internal carotids. And then the other 2 vessels that feed the brain are the vertebral arteries. The vertebral arteries are little branches of the subclavian on either side that like this. And carrying blood flow to the brain as well. Okay, so this would be the right vertebral artery, the left vertebral artery. It has come like this. Now, what makes the vertebral arteries special, in my book, is that they pass through these transverse foramina, okay, within the cervical vertebrae. Remember that one of the characteristic features of cervical vertebrae is the presence of transverse foramina, which are not present on any other vertebrae. So the vertebral arteries are going to pass through 7, 6, 5, 4, 3, 2, 1, through all the transverse foramina, and then once they pass through the transverse foramen of the first cervical vertebra, the atlas, then they both pass through the foramen magnum to enter into the intracranial cavity. So what does that tell us? It tells us that there are 4 vessels that feed the brain. The right and left internal carotid artery, and the right and left vertebral artery. This is a lot of stuff we've learned already. In like 15 minutes, we've learned a lot of stuff already. Now, I'm going to help you with the blood flow to the brain because this is something you have to commit to memory forever. I always like to brag that Jackie Wynn got accepted to PA school the first week. She was the last person accepted to the school. The last week, she got notified that she was moved from the waiting list to the active list. And so she bought her books, moved on in. She was the last to be accepted, but the first to graduate. She went from worst to first. And she made a mark during the first week of class when a teacher asked in anatomy, what vessels provide blood flow to the brain? Of the entire class, she was the only one that could state it was the right and left internal carotid and right and left vertebral artery. So that's impressive. And there's a way I remember this. There's a way I remember this from early on. And this goes back, this little, we use memory devices, mnemonics, like BCS. When you have to learn a large volume of information, you have to come up with little tricks to commit things to memory. And so, when I was just in high school, okay, this was funny, we had this JROTC. And so part of the JROTC program was during the summer before your sophomore year, either some kids went to Camp Lejeune and some kids went to Camp Pendleton, and you did like basic training for 2 weeks, basically. Okay, and just remember there were a lot of bugs out there, and you had to wake up real early in the morning. And so you'd get out there in the morning, real early in the morning, and one of the things you had to do a lot of was marching. And that would be kind of drudgery to most people, except one thing I liked was they did these chants. Okay, that had kind of a rhythm to them. Okay, and it was kind of fun because the guy, the drill sergeant, would start singing these chants, and then you would kind of follow his lead. And then, because these chants were really kind of interesting, they were easy to remember. They were kind of funny. okay? So, and it helps you keep your cadence, you know, because you're doing the left, 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 right, left, and the cadence kind of helps you with the steps. Of course, if you fall out of step, then you have to do a little skip step to catch up. So, what I did in my mind, I remember when I was learning vessels, is I came up with a little cadence for the vessels that provide blood flow to the brain. So what I'm going to do is I'm going to say the first line, and you just follow with the repeat. Okay? Are you ready? Okay, so I'm going to say it, then you simply repeat in the same fashion. Now sing song, that's all right. Believe it or not, it'll help you remember. I don't know, but it's been said.
I don't know, but it's been said.
Therefore vessels to the head.
Therefore vessels to the head.
Carotid arteries feed the brain.
Carotid arteries feed the vein.
Vertebral arteries do the same.
Vertebral arteries do the same.
Left, right.
Left, right.
Carotid arteries.
Carotid arteries.
Left, right.
Left, right.
Vertebrals too.
Vertebrals too.
I don't know, but it's been said.
I don't know, but it's been said.
Carotid arteries help you talk.
Carotid arteries help you talk.
I don't know, but it's been said.
I don't know, but it's been said.
Vertebral arteries help you walk.
Vertebral arteries help you talk.
Right, left.
Right, left.
All right, so you get the idea. That's your left, right. Why would I say that carotid arteries help you talk? Because they do what? To the language centers. The Broca's and Wernicke's area are fed by branches of the carotid. Okay? Here's the brain. The internal carotid comes up and it bifurcates into two branches. An anterior cerebral artery that feeds mostly the frontal lobe. Okay, so we call this anterior cerebral artery. And then a middle cerebral artery that branches along the lateral aspect of the brain, and it's going to feed the language centers, as well as the primary motor and sensory cortices. So when we say the carotid arteries help you